Today we're going to talk about penile implants. And is it really the best option for you, or is there something that's more effective? Hi, my name is Brock Roberts from Happy Valley Clinic. And in today's video, we will be discussing the pros and cons of a penile implant and alternatives that you may want to consider before moving ahead with this surgery. Penile implants cost somewhere between $13,000 and $35,000. Generally, you're looking at somewhere between 20 to 25 grand in order to get a penile implant. There are other options that are available, right? One being, let's say that you went and got a penis pump and a cock ring to hold the blood in. That option, you're looking like $100, right? Is it effective and does it work always? Not generally. Another option is focused shockwave therapy or linear shockwave therapy. What is the cost for that care? Well, generally you're looking at somewhere between $3,800 and $8,000, and it just depends entirely upon what the need of the patient is. Penis pump's nice, it's quick, but the likelihood of the blood staying in the penis with the utilization of a cock ring isn't very likely, especially if you're already having such challenges to the point that you're considering getting a penile implant. The positives to a penile implant is that it's going to allow you to have an erection again, which will allow you to have that wonderful connection with your sweetheart. That's the positive. There are contraindications that can occur. One being infection, and that is possible. As with any surgery, infection can occur. There can be implant problems once the implant is in. The more recent models are a lot more reliable, but in rare cases there still can be other issues and contraindications with those implants. With the penile implant, there can also be internal erosion or adhesion, where the actual unit sticks to the inside of the skin of the penis, which can cause serious problems, and even to the point where the implant would need to be removed. In other words, going back in under surgery. After a penile implant surgery, you're going to need to take time off. It's going to be about 2 to 4 weeks before you can be back to normal activity. You'll be able to walk around and things, but it is recommended that you're going to take 2 to 4 weeks off of work after that surgery. Before going down the road of getting a penile implant, there's a few things that you'll want to do. One, you want to make sure that the vascular system within the penis is completely deteriorated, that's not even an option, right? And going to a professional or a medical clinic where they focus on sexual health and wellness is really vital. One, you'll want to get an ultrasound done with a Doppler unit that will allow you to be able to hear what type of circulatory flow that you're getting or not getting, and counsel with a medical professional on what that looks like, what it sounds like, right? And what type of flow that you're getting. If you have decent flow or zero flow at all, the medical professional will determine as to whether the utilization of a focused shockwave treatment is going to be best for you, or if pelvic floor strengthening is going to be best for you, or if microcirculatory therapy is going to be best, a P-shot is going to be best, or if a combination of those treatments will be in your best interest. Is your testosterone where it should be? Is your estrogen levels where it should be? Are other levels within your body regarding what's happening inside where they should be? And those are things to consider. Now, know this, that it doesn't necessarily mean that if your testosterone levels are where they should be, that now you're going to have great erectile function. That's not the case at all. What it does come down to is that if circulatory-wise you're not where you need to be, there's no amount of testosterone that's going to bring those erections back. It's a nice piece of the puzzle that if we have that in place and you have that vascular flow back where it needs to, they can complement one another. Now the question is, who or what patient is the best candidate for this procedure? It would be recommended that this be the last resort in gaining erectile function, as there are clearly more effective and less painful avenues that are natural than going under the knife for surgery to unnaturally have sexual intercourse again. With viable options to naturally bring back erections, it is best to exhaust all of these other options before entering into the option of a penile implant, as these other options oftentimes will have no downtime at all and are actually painless, as the tissue within the penis recovers, and are far more economical than what a penile implant would cost. If you would like to schedule a personal consultation to discover what type of treatment is best for you and for your erectile dysfunction, visit happyvalleyclinic.com or give us a call at 833-ED-NO-FUN. That's 833-ED-NO-FUN. And remember, we're here to help you keep it happy.